Is your practice tired of wrestling with insurance denials, deciphering EOBs, and watching your revenue slip through the cracks? You are not alone. Welcome to The Claim Game, the podcast designed to cut through the confusion and provide you with the best practices for revenue cycle management success. We are Jeremy and Catherine Zug, and we've been with people just like you in the trenches. Each week, we'll break down complex billing processes, share real-world solutions from practices like yours, and ask questions of the game makers and changers of healthcare so you can take control of your revenue. Let's turn those claim denials into deposits and help you return to focusing on patient care. It's time to win the claim game.
Hey, welcome back to The Claim Game. Catherine is 54 weeks pregnant, and I'm Jeremy, and this is Catherine Zug. And as a reminder, in this season of The Claim Game, we're going through the revenue cycle management best practices, one board territory at a time. Last round, we had a really interesting conversation around provider assignment and scheduling. So remember, we're reviewing the key territories, and mastering each one is crucial for victory in your practice. So we'll be grabbing a magnifying glass to zoom in on spaces within these domains. We're going to reveal the winning strategies to navigate the board with ease and confidence, ultimately claiming victory for your practice's bottom line. Quick reminder, if you missed the initial setup and want to understand the full scope of the board and how the 6 domains of billing work together, be sure to check out episode 1 for the complete overview. So let's focus our attention on the current territory, patient registration. Today, we're zooming in on the riveting world. Exciting world of HIPAA compliance. Get ready to analyze its unique challenges and discover the optimal moves to conquer it. Catherine, when practice owners hear HIPAA compliance,
Yes.
What do you think they want to do when they hear that term?
Well,
Like run for the hills.
probably not listen to a whole podcast on it.
But it's really important.
But maybe they do, because it is one of those things they're like, I know that I have to do something about this, but who's going to lay it out for me? We're going to try to lay some of it out for you.
Can you give us a high-level overview of what HIPAA is and why it's so vital during the patient registration process?
Yes. So HIPAA, HIPAA.
AA.
For a long time, I wrote it HIPAA.
There's no two P's.
It stands for Health Insurance, Health Insurance, Portability, and Accountability Act. It is a federal law that establishes national standards to protect sensitive patient health information, PHI, from being disclosed without the patient's consent or knowledge. So really the main goal of HIPAA is to protect patient privacy while still allowing for the flow of information needed for healthcare to continue. So there is this kind of fine line between keeping information private, but then we also need to use enough of it to properly care for patients. And so it's really important specifically during patient registration, that we collect, store, and transmit this very sensitive patient data properly. And patient registration is where you first do all those things, which is why it is part of this patient registration territory.
And we're going to take a brief minute and talk about something that has come up a lot, and we're going to deal with it just head on. So we've been hearing lately about patient data in our done-for-you billing services. Internally, we call it DFib, in keeping with medical language. So we defib your billing, get it? Your billing.
Done for you.
Yeah, done for you. Sometimes your heart needs it done for you too. You know what I mean?
Yeah.
Some of our larger competitors are undercutting prices by offshoring a lot of their keystrokes, but we've been hearing so many providers who are not willing to have their patient data accessed offshore because there's no data safety guarantee. I just talked about this with a friend of ours on an episode that we'll release here soon about this exact topic, but they aren't held to the same standard. Right? Offshore companies are not held to the same standard because HIPAA, 1P, no PP, is an American law. Yes, ideally they would have to uphold it if working for customers in the US, but it's definitely a risk, yeah?
Yeah, I mean, I think there's even some uncertainty as of late about the legality of offshoring in general.
Which we'll talk about.
Yeah, there are a lot of reasons we have chosen to keep all of our staff stateside, including just the people that we hire have experience in real practices, United States-based practices, which I find a lot of the time just helps with patient or client relations. It is definitely a huge consideration to think about patient data and the safety of patient data when choosing to offshore. But before we move on from this topic, remind me, there is a state that actually for a while now has not allowed offshoring of patient data. Can you tell us a little bit more about that?
Yeah, I sure can. So Florida passed a law, I think it was in 2022. Don't quote me on that, but it was in the 2000s.
2020s.
The roaring 20s, banning electronic health record systems from storing any of their data offshore, which is a really unique piece of legislation. So if you're an EHR and you're in Florida and you're offshoring any of the storage of your data and offshore, or anybody offshore is accessing it, it's not technically legal to do that. And
yeah, does that have to do with IP addresses though? Like, I'd be curious, like, is it technically stored offshore if I'm just using an offshore IP address to cloud-based access?
I don't think so, but that's a good question. I'm not sure. I'm not an attorney who can't give legal advice. It underscores this idea that you should keep patient data here, right?
Or at least it needs to be a consideration, like your data is going to be accessed
by somebody else, but you don't know where it goes. You don't know where it goes. You don't know who's doing what with it. And at the very least, and I'm not a litigious person, but if you needed to sue somebody, you don't want to get an international lawyer involved in order to sue somebody overseas. Yeah, you want to be able to navigate that here. It's the rules, you know the steps to take in our legal system. It's much, much better to do that stateside than it is overseas.
And I think we're going to talk about this in a little bit, but business associates agreements. So like as a billing vendor, I do not have any PHI responsibility because none of the data belongs to us.
Right.
But there are rules about how I interact with someone who is taking me on as a business associate, as a vendor, which I would imagine that an offshore billing company would have to sign a BAA. But at the same time, can you uphold that in the same way?
Through their courts, I imagine.
Yeah.
Which you don't want to do, by the way.
So there are questions for sure about that.
For sure. So it's a big risk. Don't take the risk. Keep everything in the family, as it were.
That's our tangent for the morning.
That's our small tangent. So when we talk about sensitive patient data, I'm a sensitive patient. What exactly are we referring to? Can you break down what falls under the category of protected health information or PHI?
PHI is any identifiable health information that is created, received, or transmitted by a HIPAA-covered entity. So this would include any patient's demographic information, name, date of birth, address, phone number, email, contact information, things like that. Medical history. So yeah, that's where we get into visits, vaccination history, test results, and then any of their insurance information, ID number, policy, subscriber information. It also includes more specific identifiers like full legal names, social security numbers, and even IP addresses.
I didn't know that.
Yeah.
That's cool. That makes sense. Yeah. So that's a pretty comprehensive list. What are the primary rules or principles that govern how we handle protected health information, particularly during patient registration?
There are 3 rules that we're going to talk about, but there are 2 main rules that we need to be mindful of specifically on how we govern PHI, and that is the privacy rule and the security rule. The privacy rule sets the national standards for the protection of PHI, and it applies to all forms of patient health information, which can be, I think we often would think, physical, written, and electronic, but oral is also included in the privacy rule. So 100%. Even just speaking with somebody about a patient, there are rules.
Our case study card is going to deal with that very issue.
Of course it is. So this gives the patients the right to obtain a copy of their health records in the form and manner that they request. They should have free access to their data and to ask for any corrections to their information. It also permits them to use and disclose health information needed for patient care for other important purposes. So usually when a patient comes into a practice, and we talked a little bit about this in intake, but there is a HIPAA release form that patients have to fill out, and that's related to the privacy rule because they have to give permission to your entity as a practice in order for you to release their PHI to even the clearinghouse and the insurance company.
Yeah, that's right.
That is not a given. If you don't have that form on file, you actually don't have permission to submit claims.
Yeah, this isn't the Wild West. There's like actual rules here.
But I would also make the argument, why have an insurance policy if you're not going to give permission to submit claims?
Great point.
So there's some conflict of interest there,
Yeah.
But so that's the privacy rule. And then there's the security rule. And this is what sets national standards for protecting PHI that is in electronic form, known as ePHI. It requires administrative, physical, and technical safeguards to ensure the confidentiality, integrity, and security of that information. So covered entities and business associates like us must develop and implement policies and procedures to protect the security of the ePHI that they create, receive, maintain, or transmit.
So taking those rules into account, what are the absolute best practices for a practice's staff to follow when handling patient information during intake and registration?
I'm going to give some general answers on this, and then we're going to go into specifics. So let's talk generally about this. You must obtain the patient's authorization to release their PHI for treatment, for payment, and for healthcare operations. And that, again, is covered in the patient intake packet. And we mentioned that in the intake round, which was 2 or 3 rounds ago. So you need to ensure that all patient data, such as intake forms, that would be patient data, IDs, insurance cards, those all, when they get collected, they need to be stored in a secure HIPAA compliant system like your EHR, and EHRs are not created equal, so you will want to look into...
You can say that again for the people in the back. EHRs are not made equal.
Can mean a lot of things. It can mean that some are just really hard to use. But in this case, I mean, the level of security that they offer is going to vary, and I think there are requirements that they disclose what level of security they have. So you might have an EHR system that you wouldn't want to store that in, although I don't know why you'd be using that EHR system. So just look. Utilize secure methods for communication with patients, encrypted emails or secure patient portals, especially when sharing sensitive information. And there are different, I would say most of those options are paid options.
I think that's right.
For emails.
Yeah.
To get that extra level of security, you should not be doing this through a general Gmail
No,
account.
don't do that.
You should not be interacting with them as a patient. If you identify that they're a patient in an unencrypted email, oops.
Oops is not an option.
Oops,
so
yeah.
Make sure you get that squared away for sure.
Continuing to speak generally.
Yeah.
Training for your staff on HIPAA rules and your practice's specific protocols. And we're going to go into how to set protocols, but that's really a non-negotiable for running a practice and staying compliant. There should be day one HIPAA compliance training, whether they want to or not. I'm sure it's the most boring part of training, but there needs to be training. There needs to be logs. There needs to be ongoing training.
You can also make this stuff fun, like pin the tail on the non-compliance would be a really good game to play if you're going to do because people are going to want to snooze through this training. So figure out a way to make it more exciting. So what about for a practice that keeps physical forms on hand on file? Every practice I've worked at, there's been some needed, well, I don't think needed, but they've all had physical forms or physical charts on site. So What about those?
I mean, especially if you are working with populations that don't want to go digital or have a hard time accessing computers or whatever it may be, like it makes sense that you're going to have physical copies of things. But just because you start with a physical copy does not mean that you have to keep a physical copy. My recommendation would be to scan and shred that document. If you don't want to do that, that's not your cup of tea, that's fine. You can file it away, but you cannot keep anything face up on your desk, especially overnight. And I actually talked to a practice when we were in Charlotte last October who was using an EHR that they had only been using for 5 years. And before that, they had done everything physically. And the reason they moved into an EHR to store all their data is because their whole practice went up in flames.
Oops, burned it down.
I don't know. I actually didn't ask about the cause of the fire.
We just cared about the PHI.
But that was the motivator for them to move into an electronic system. And I'm like, that you would lose everything. And if you have a legal requirement to give your patients their data, how can you do that if you've burned all of their patient data?
Like literally burned it all.
Yeah. So it's a huge risk to do that. So if you're going to keep things physically on hand because you've done it forever, that's fine. Maybe keep a second copy electronically or off-site in a different secure location.
That's right. I mean, don't be making s'mores over PHI is really what Catherine's saying.
Unless you're using that as your shredding method.
Yeah, shredding guitar, baby.
Shredding or burning, you can do that.
Yeah.
We used to burn our PHI before we got our shredder.
Shredding guitar. Man, I love that movie. All right.
So I do want to say that this brings up a very similar point, which is digital data. So people think that if it's on a computer, it's in a secure location, and that is not true. If you are keeping things digitally, you should not be downloading this onto your computer. It should not be in a download. It should not be on a desktop. So we actually chose to get all of our billers Chromebooks because downloads are not possible on a Chromebook. So every patient, anything that crosses a proverbial desk in our business,
hidden.
Well, it goes into downloads that is related to the encrypted
file storage. Yeah, make the right thing easy and the wrong thing really hard. So I think that makes a lot of sense, Catherine. And I think your tips and tricks for PHI management make a lot of sense.
One of the worst parts of my job, seeing practices lose revenue, not because of bad care, but because their notes didn't back it up. If you're billing insurance, you already know that your notes are your defense. So if your documentation falls short, clawbacks, appeals, and a whole lot of headaches feel inevitable. One of the best parts of my job, empowering our clients to focus on their practice, not payer back and forth. A big part of that has been discovering Blueprint, an AI assistant purpose-built for mental health care. In other words, made by therapists for the way therapists work. I've seen folks start using Blueprint to help with getting progress notes done faster, but it has turned into a game changer. Blueprint drafts compliant treatment plans, visit notes, and flags any missing clinical notes, which means fewer denials, cleaner claims, and faster revenue capture. Check the notes for the link to give Blueprint a try for free.
Are there any protocols that we should think about implementing in our practices?
Yes. So let's go into the specifics. That was very general. Let's talk specific to these rules that exist. So there are protocols that you should have in place for each rule, and there are steps to be compliant. So starting with the privacy rule, the first thing that you should do is assign a compliance officer.
Ooh, that sounds like a promotion.
You're the compliance officer at our companies.
Which makes sense.
Do you feel like you're on top of the food chain as a compliance officer?
I'm so compliant.
You're the hall monitor.
I am the hall monitor. I have a sash, and I will give you a ticket. No, listen, it's a really big deal. For this role, this is not like you're not assigning this to the temp or the intern. This is somebody who should serve as something like an organizational memory for your practice. So somebody who's stable, who's not going to flip over, organized.
Someone who's steady. I would not put someone who's going to like freak out about a minor
Nope. You
issue.
You want a decent person here.
You might be asking what they do. Let me tell you. So they need to maintain the HIPAA compliance documentation and procedures of your office. That means that they would be the ones training team members on the compliance process. They would be the one handling any breach notifications. They would be monitoring the compliance with any HIPAA legislation. So they would need to be the ones keeping up on legislation, which I just said, and handles requests for patient records by any client. So if a patient calls in and says, I would like this, whatever your internal process is, it needs to flow past this person's desk for approval. That's step 1. Step 2 for the privacy rule is develop internal HIPAA policies required for all staff. So you have rules for managing access to software tools that your staff need to be trained on, how to handle and destroy physical PHI, 2-factor authentication requirement.
Yeah, 2-factor.
It's the biggest breach.
Oh, so easy.
Yeah.
So easy and so effective.
That was related to the biggest breach. Right?
Yes.
The
yes,
Change Healthcare breach.
Yeah.
In 2024 was related to 2-factor authentication and the lack thereof. And then they're going to develop a plan. How are we going to notify management of a breach? So again, managing access to software, 2-factor, how to handle and destroy physical PHI, and then how to handle a breach, how you would communicate a breach to management. Number 3, they would be the one keeping an attendance log for all HIPAA compliance trainings. Not fun, not like a fun thing. This is a very administrative person. It's going to get signatures after trainings.
Riveting.
Yes.
It's riveting work, you guys.
4, create customized SOPs for each internal role to help them complete their job functions in compliance with HIPAA policies. I recommend this, whether it's about HIPAA compliance or not, just that you have
You need SOPs. Yeah, bottom line, you need them.
At the very minimum, short videos for how you do everything. It doesn't have to be a written document that gets obsoleted every.
Yeah, live it, love it, baby.
And then number 5, determine an annual recurring date when you will go through physical PHI and permanently dispose of anything that is older than 6 years. You will verify access to PHI for employees who need it for their roles. You will verify unique credentials for each employee with multi-factor authentication, and you will review the logs and update permissions to match current roles.
Nice. So that was all
an annual audit.
That's all the privacy rule, right?
Mm-hmm.
Are there any protocols for the security rule?
Oh, you betcha.
Oh, you betcha.
Yep.
Run it back.
There are three things that you should do for the security rule. 1, you need to make a list of software systems that you use to run your practice, such as Google Workspace, email, any kind of drive, sheets, docs. Yes, so for the security rule, there are 3 things that you need to do. The first is to make a list of software systems that you use to run your practice, which might include, and this is not a comprehensive list, something like a Google Workspace or an email, a drive that maintains all of your files, some kind of sheets or docs. So maybe this is Microsoft instead of the Google systems, an EMR or an EHR system, cloud storage system, a client messaging app of some kind, a telehealth platform, a payer portal, laptops, cell phones.
Makes sense. You gotta lock it down.
Mm-hmm. So that you know all the things that need to be reviewed.
All the things.
And then 2, verify that your software systems are HIPAA compliant. Each system must have 256-bit encryption.
If that sounds weird, you'll see it immediately if someone claims that their software system is HIPAA compliant. They'll know what that means.
Each system must have 2-factor authentication. And each system must have an active business associates agreement with your practice, which usually if there is healthcare related encryption, that's an automatic part of your sign up for something
easy
like a Google
peasy.
Workspace.
They'll make you check a box or sign a thing. It's easy.
And then there's the physical security measures of the security rule. So you need to limit physical access to areas where PHI is stored through things like a lock on a door, a key card, maybe a lock on a file cabinet, some kind of controlled access system. Position your screens and workstations to avoid exposing PHI to unauthorized viewers. So if you're an admin and you have admins let's say they're in a horseshoe, well, that might not be the best option, because if you have screens over here and there are patients that can see in,
no good.
That might not be a good idea. Dispose of physical PHI securely through shredding.
Shredding guitar.
or burning, or other HIPAA compliant destruction methods. And that is the security rule.
That's awesome. What are some specific red flags that would indicate a potential HIPAA violation during patient registration?
Well, a major red flag, and I've said this already, but is leaving patient intake forms or other documents containing PHI in an unsecure location where others can see them, or storing digital patient information on personal devices or in unencrypted cloud services. Those are all violations. Discussing a patient's information in a public space, like a waiting room, is also a breach of the privacy rule. Improper disposal of paper documents by not shredding them, like if I'm just throwing them in the trash, not great. Yeah.
What happens if a breach occurs? Are there specific protocols a practice has to follow? Do you send out, do you drop pamphlets from the sky? What are you supposed to do?
Yes, you have to rent a helicopter.
Wow.
And tell the whole world.
And rain down on the public?
Rain down. No. I mean, yes, there are things that you need to do. This is where that breach notification rule comes into play. So here are the implications. Most notifications must be provided without unreasonable delay and no later than 60 days following the discovery of a breach. But there are different definitions of breach as well. Smaller breaches affecting fewer than 500 individuals can be submitted to HHS annually. What is HHS, Jeremy?
Health and Human Services.
Yeah, so that can be submitted annually. Business associates of covered entities must notify the covered entity of a breach at or by the business associate. So if we breached and made a HIPAA violation, we would need to tell, in our example, the practice owner that we breached their information. And then there are some steps to be compliant for a breach notification. So you need to establish a plan to quickly respond to any data breach, whether electronic or physical. You need to know the HIPAA breach notification requirements and timeline, and establish a protocol to notify affected individuals, the Department of Health and Human Services, and the media if necessary.
Yeah, in some cases,
which I think that has to do with the volume.
Yeah,
of
it
the
does
issue.
have to do with it.
And then 3, document each incident thoroughly, including the corrective actions taken to prevent future breaches. And again, train your staff on any new process creations as a result of the corrective actions taken. If you found that you had a hole that needs to be patched in an SOP, then you need to change your SOP and retrain your staff. And then there should be some testing of that SOP to improve your process and ensure compliance with the new systems.
That's great. Yeah, thanks for that. You've outlined some fantastic actionable steps for our listeners. Are there any helpful tools you can recommend to help assist a practice in implementing these best practices?
Yes, I sure can. So I recognize that there's a lot of things that I said that can possibly be foreign to a practice, and there's a lot of paperwork that can help organize this information. So our HIPAA compliance guide is designed to be a clear, practical resource for any practice owner or staff member. And here is what is included in our HIPAA compliance guide. A HIPAA compliance checklist, new employee HIPAA training completion form. So when you hire a new, would fill out after their training is complete. Ongoing HIPAA training log. We have a blank log that you can use. A software access and permission review chart that shows that each employee has the proper access to PHI. A business associates agreement guide for creating BAAs and for saving them for any vendors. A template for your practice's HIPAA corrective action plan. And then there is instructions for creating your practice's privacy policy, which mostly just links to the right resources for that. But
yeah, let me just say something. If you want to contract with a vendor and you say, all right, do you have a BAA? And they go, huh? Not a good fit for you today.
They should even know the abbreviation.
Yeah, they should even know the abbreviation. It's just
very well known.
Yeah, it'd be like saying to a mechanic, like, where are the wheels? And for them to say, I don't know what's a wheel. It's important.
Yeah. So now that's the end of HIPAA. Hopefully I gave you some clarity around those 2 rules. I swear there was a 3rd rule. I guess breach notification.
No, that's the 3rd one. Yeah.
Okay.
Yeah, we covered it all.
Okay.
Folks.
Covered it. Privacy rule, security rule, breach notification rule. That is what you need to know.
Bada bang.
What they are and the different things that you need to have in place to be compliant with them. But now it's time in our episode for a case study card.
Sure.
So today, I'm hoping, Jeremy, that you can tell us about a time that you saw a practice suffer from a HIPAA violation during the patient registration process. What happened?
So this is when
how could it be avoided?
This is when we didn't have a good one just organically. So if you all are really curious, you can go to several government websites and you can look up cases where things like this were dealt with. So I'm going to share one of the publicly available cases where this was actually an issue. So if this sounds like your practice, you might want to check to make sure that it's maybe on a website of a government organization somewhere. So there you go. So a staff member of a medical practice was discussing HIV testing procedures and testing results with a patient in the waiting room. Yeah. I mean,
that's crazy.
That's not exactly the kind of thing you want to talk about
in
the waiting room. And thereby they disclosed PHI to several other individuals, right?
Yeah.
I mean, there's a lot we could say here, but you don't really want to be talking about this stuff publicly. And also the same medical practice, computer screens, like what Catherine was talking about, were displaying patient information and were easily visible to patients. So among other corrective actions to resolve the specific issues in this case, the OCR, which is regulatory agency, required the provider to develop and implement policies and procedures regarding the appropriate administrative and physical safeguards related to the communication of PHI. So
no kidding.
Actually, no kidding. Yeah, and you can find that one online. That's
So tip for you, don't talk about test results in a waiting room with your patient.
That's right. Especially like if somebody's goose is loose and you don't want to like explain that to a bunch of people. So the practice trained all of its staff on the newly developed policies and procedures. In addition, OCR required the practice to reposition its computer monitors to prevent patients from viewing information on those screens.
No kidding.
So the practice installed computer monitor privacy screens to prevent impermissible disclosures. Those are the same things that you go to the bank and your banker has to like take it off the computer to show you something. That's what they're talking about there. It's like they make them for phones now where you can only see what's on the phone from a certain
you also
angle.
even think about a patient check-in form where like they have the ones where you can rip off because you don't want to, like if 5 patients before is like my neighbor
John, Rick, Arda. But
that would be a problem.
That's right. So that's a good example.
Yeah, really interesting.
So today we talked about HIPAA compliance. We discussed a tool today, the HIPAA Compliance Guide, and that's available on our online learning hub, the Hourglass. If you think any of those would be helpful for your practice, please check out the link in the show notes to the Hourglass. We've spent a lot of time developing those resources for you. We think that they add a ton of value and clarity to your practice. So please check that out.
Next time on the Claim Game, we will discuss checkout, the final stage of patient registration.
Whoop, whoop.
So tune in to learn how to close out patient registration in a strong position. You won't want to miss it.
Thanks, everybody. If you enjoyed today's episode of The Claim Game, please take a moment to leave us a rating and review wherever you listen to your podcasts. It really helps new listeners to find us. Make sure you never miss an episode by subscribing to The Claim Game on your favorite podcast app. Your feedback means so much to us. We want to provide valuable education about revenue cycle management. So if there's something we didn't cover in our topic that was a burning question for you, please let us know so we can try to get you the information you desire. You can find the links to all resources we mentioned in this episode in the show notes. And if you want to dive deeper into our resources, we have 2 places you can do that. First, you can go to our blog at practicesol.com/blog, where we have 8 years of educational blogs. If you want to learn more about what Practice Solutions does, reach out. We'd love to hear from you. Just go to practicesol.com to learn more and to connect with one of our awesome people on our team. Thanks for listening. We are Jeremy and Catherine Zug, and this is The Claim Game. See you at the game table next time.